Hello everyone, my name is Sidra. I'm a pharmacist and welcome to my channel, Ask Your Pharmacist. Well, today I'm very excited to share that FDA has finally approved voltaren gel to be available over the counter. This gel basically works wonder. I've personally used it and I've had many customers swear by it. Literally, it works wonders. Now, I'm not here to advertise about the voltaren gel. Voltaren gel or the generic 1% diclofenac gel, the same thing. I'm basically going to talk about the medication like diclofenac 1% gel because this really provides big time relief to those struggling with the joint pain, arthritis of the knee, foot or hands. So let's just dive right into it. So the diclofenac gel or the 1% voltaren gel is a non-steroidal anti-inflammatory, which is an NSAID. It is used specifically for joint pain, arthritis pain, and it is applied on the hands, knees, feet, and it does not really work well for the relief of pain on any other areas of the body, okay? So first things first, if you have heart disease, high blood pressure, risk of clot, or you have any blood thinning, do not use diclofenac. This is not for you then. If you have had a heart surgery or you're going for one, you've had cabbage or bypass graft, then again, this is not for you. Also, if you're allergic to diclofenac or any of the ingredients used in this topical gel, do not use it. And the signs of allergy would be any rash, any bruising on the site of the application. So that's something to keep in mind when you're using the diclofenac gel. Another very important point, do not use it in pregnancy. Especially in the last trimester, if you use any oral NSAID or the topical NSAID like this, it can really harm the unborn baby, so just be very careful about it. Like I said, voltaren gel is a non-steroidal anti-inflammatory. It works by decreasing the production of prostaglandins, which is basically a hormone produced when we have pain or inflammation. Now let's talk about how the medication is used. The topical gel can be applied 4 times a day, normally 2 grams to 4 grams. Now, a lot of people ask me, how do I know how much is 2 grams or 4 grams? So simply, if you look at this box, inside the box, they have a tape measure in it. I'm gonna show you. It looks like this. I hope you can see it in the camera. So this top line that you see over here, like the orange one, that measures 2 grams. The bottom stripe, the blue one, that measures 4 grams. And you know, let's say if you lose it or if you don't have this, no big deal. I tell my customers that usually 1 fingertip is your 1 gram, and if it's advised to use 2 grams, then use 2 fingertips. Just apply on the painful area, rub it in like a cream, let it sink in. If you're applying on your hands, do not wash your hands right away. You know, wait about 10-15 minutes before you put on gloves over your hands, okay? And secondly, you know, once you've applied it, and do not go swimming or don't shower or bathe right away, okay? You have to make sure the medication kind of sinks in the skin. Okay? Do not apply it on the broken skin. If you have burn or wound on the skin, if it's bleeding, big no-no. Please do not use it in that case. Also, once you've applied it, do not cover the site of application. So do not put any heating pad or do not go sit in the hot bath or anything that could, you know, make the surface hot, because once you apply anything hotter on that surface where you've applied the diclofenac gel, it's going to increase the absorption of the medication. That's the key point, because heat actually increases the absorption of the medication. So, I mean, if let's say it was available 6% systemically before, now heat could increase the availability of the medication like 10% or 12%. Some people may think that, oh, maybe I should apply heat because then the medication is going to be more effective. No, you don't want to do that because it can result in toxicity. So don't take a chance. As far as the storage of the medication is concerned, to store at room temperature, you don't have to put it in the refrigerator. And also, please keep it away from direct sunlight and do not freeze. Once you've applied the diclofenac gel, do not apply any cosmetics, sunscreen or lotion over it. Avoid any tanning beds, avoid direct sunlight. Also, make sure not to apply it anywhere near nose or eyes, because you don't want your medication to get in your eyes and nose and get poisoning. Now, when you're using the diclofenac or voltaren gel, avoid using any over-the-counter NSAIDs, which include your Motrin, Aleve, ibuprofen, also aspirin. However, 81 milligram aspirin, which is used as a cardiac protectant, like heart protectant, is fine, but still do consult your doctor or talk to your pharmacist. Have the pharmacist look at all your like medication profile, and then let your pharmacist actually consult you about it. If you develop any rash after using the medication, again, stop using it. Now, one thing to keep in mind is the medication is not going to show its effect right away. It's no magic here. I mean, you apply the medication, don't expect to see its effect right away. It'll take about 5 to 7 days to kind of see its effect. However, you don't want to use it for more than 2 weeks or up to 21 days. If after using it for like a week or 2 weeks, if you see that it's not giving any relief, then stop using the medication and see a doctor. Because at that point, it's very important to find out the root cause or the underlying cause of the pain. It could be something else. You probably need some oral medication, or you probably need a steroid at that point. So make sure, if you do not get any relief after using it for 2 weeks, see your doctor. You know what? In general, with any over-the-counter medications, I do recommend my patients that if you don't see any relief for after using it for 3 to 5 days, you must see your doctor, because over-the-counter medications do not substitute a visit to a doctor's office. I know a lot of us like really avoid going to the doctor's office, but sometimes it's really worth it. So make sure you see your doctor, get it diagnosed. Don't just assume that, oh, I think I have the symptoms of arthritis, I'm just going to use it and it's going to go away. Well, if it is minor, then it's probably going to go away and you'll see it in 5 to 7 days. But if it's not giving any relief, see a doctor. Finally, let's talk about the effectiveness and the interaction of the diclofenac gel. Now, this medication provides targeted pain relief. Like I said, you use it on the joints. So it's really providing you relief on those joint areas or the painful areas of the body where you're applying it. And one thing to keep in mind, you cannot apply it on more than 2 painful areas of the body. Now, is it comparable to the oral diclofenac? I would say no. But like I said, it provides more targeted relief, okay? Since it's topically applied, the absorption of this medication is only up to like 6%. So there are lesser risk or chances of interactions with other medications, but still the chances are there, okay? It is very important that you're well aware of what not to use when you're using the diclofenac or voltaren gel, because like I said, the risk is still there. So being an NSAID, the medication does interact with your blood thinners. For example, warfarin, which is also called Coumadin, Plavix, Brilinta. So basically any blood thinners, okay? Also your blood pressure medications, especially your diuretics, which are the water pills like Lasix, hydrochlorothiazide. Also, if you're using Trexol, which is methotrexate, or you're using lithium. So be very careful when you're using diclofenac with all of these medications, okay? Always talk to your pharmacist. Let your pharmacist and doctor know about the list of your medications, not just the prescription, but also your over-the-counter herbal medications or any other over-the-counter medications. Like, for instance, many people like to use ibuprofen or Aleve for migraine. Now, ibuprofen and Aleve, you probably don't know that it's an NSAID, and then you start using diclofenac gel as well, which is an NSAID. So you may get like double the effect, and it may result in toxicity, okay? Because guys, these are not candies. These are actual medications which can kill you, can cause toxicity. So please, no playing around with your medications, be it your prescription medications or over-the-counter medication. Anyways, that was just a side note or a pharmacist advice. So keep that in mind, please. Finally, I'm going to talk about what is the difference between the prescription diclofenac gel and over-the-counter voltaren gel. Now, sorry, voltaren gel. They are exactly the same thing, guys. There is no difference at all. Now, can you get the generic diclofenac, which is present behind the counter in the pharmacy? Unfortunately, for now, no. Because most of the packaging of the diclofenac gel which are available in the pharmacy still say RX only. So guys, I'm sorry, as a pharmacist, our hands are tied. If the package says prescription or RX only, we cannot sell it over the counter, even though FDA has approved this medication as over the counter. I know it's kind of dumb, but I'm sorry, this is what it is. Alright guys, so this is it for today's video. I hope you enjoyed it and learned a lot about the diclofenac gel. By the way, this tube of about 50 grams is like $20. So I mean, it's really like, you know, worth it. You know, as a prescription, it used to be like close to 100 or a little bit over. If you do have any questions or concerns, I'm here so you can ask your pharmacist any question. I'll see you next time with another informative video. Till then, you take care. Bye.